So to talk about helpful agencies for medical supplies, because we keep talking about keeping you at home, living at home for longer and things like that, and putting these safety rails in place, but where are we going to actually get these safety rails and things from? So I took the liberty of adding in a few just phone numbers for those that are in the area here. Eastern Medical Supplies, Lawton's Home Healthcare, Parkdale Pharmacy. These are all different areas which will provide those bars and any bit of mobility instruments and things like that. And I've also,
Oh, I just wondered if they, like these agencies where you buy the medical supplies, would they install them as well, or do you have to get the things that you have?
I'm not sure about that one. They do install as well, do they?
They will.
Will.
And, you know, depending on what it is, they'll fit you. You won't just leave with an instrument. You'll be fitted for that instrument, whether that's in the home or in the actual, like, Eastern Medical Supplies facility.
Perfect.
Yeah.
Because
Will they charge for the installation? Do you know?
Yes.
Okay.
Yeah, and I'm sure that some of the bars, Jennifer, Jennifer's you're a registered nurse, correct? And she's a PCA instructor here, just for those in the room who don't know. The bars and things for tubs, I suppose, will have to be in a certain area based on height and all of that as well. So the fittings, I suppose they'll do there, but then you can install them yourself as well, I guess, if you did have the knowledge and didn't want to pay the fee.
Yeah. And usually, like, people get involved, like a social worker or an occupational therapist who is aware of what that client needs. That home has been assessed and they're contacted. Eastern Medical is contacted by people who actually have seen the home, viewed the home, and know exactly.
Perfect. So
what
your
it is.
case manager and those people that we were talking about earlier on in the presentation.
Yeah.
So they really do help you with a lot of different aspects of resources and support, and just connecting you to a lot of different agencies that you would need to deal with while journeying with the disease. So those are just a few there, but I'm sure that there are definitely more in our region, and then there are pharmacies and Lawtons and different supply centers like this throughout each health authority. And I'm sure if you went to the case manager or social worker nurse which you're working with in your health authority, they would have that knowledge. So, to speak about a few helpful agencies for assisted living in the area, we have listed here, just at random, Elizabeth Towers, Tiffany Village, and Kelly's Brook. And when we're doing this here, we're just giving you a sample of some that are in our area, and that's for no specific reason or anything. Some of these are going to be at private, some of these are going to be public, through our government and things like that. So prices may range and different things like that. So it's just to contact those agencies. Whether you're going privately yourself, then you can directly contact, say, Tiffany Village is a private assisted living home. So you would be able to reach out to them yourself. If not, you can work with your case manager, social worker, or nurse through your health authority, and they will be able to make the connection to an assisted living facility for you through their single point of entry system. So some more helpful agencies. We had last month done a session on legal and financial matters, but legal and financial matters can always come up at other times, and even if you didn't get a chance to attend that session, I wanted to provide this information here. This is the legal information line. So it provides general information about the law over the phone. Callers are also referred to appropriate law-related agencies and community groups when necessary. So it's great to reach out to them if you have any questions, as they would have the knowledge in the area and will be able to properly refer you to the appropriate group. So to speak a little bit about Revenue Canada here, as full-time caregivers and things like that, there are many different options out there for tax credits and medical expenses and caregiver deduction and things like that. So I'd just like to let you know that as a caregiver and things, you do have options within Revenue Canada for when that tax time does come around. So it's just to explore those options and make sure that you do have the knowledge on that, because it could benefit you when you are filing those dreaded taxes. I listed the website up here, and they do have an office which you can give a call to if you did have some more detailed questions and things like that. But the website also does a pretty great job of providing information there. They even do like a what's new section for seniors and things like that. So they really do keep you up to date through their website as well, if you are able to access a computer and things. But if not, the telephone always works. To speak a bit about Veterans Affairs Canada, this is another super helpful agency. It provides pensions for disability or death, economic support in the form of allowances, and healthcare benefits and services. A really great thing that I love about Veterans Affairs Canada is it covers the cost for the Medical Alert Safely Home Wandering Registry. This is a really great program which we really promote here at our society. I've spoken about it before, but I'm just going to brief on it again. The Medical Alert Safely Home Wandering Registry is a nationwide registry which you can send the identification information of your loved one who's been diagnosed to this registry, and then they will have that on file and your contact information. So if your loved one were to ever wander and become lost, you wouldn't have to go through the emergency services and file a missing persons report and wait 24 to 48 hours. The search will be able to begin right away because they've been registered with this wandering program, and emergency services and search and rescue would immediately be able to access their identification information and your contact information as the designated caregiver. So that allows the search to begin right away, and then it gives you a great peace of mind as well, knowing that the individual could be wearing the Medical Alert bracelet and wander a little bit and be on the path to become lost, but then be recognized wearing the bracelet and be sent back home and be back to your caregiving without any sort of incident occurring. So it's a great program, and I listed the website there, of course, so you can check that one out if you wanted any more information about any of the services which they provide. So to speak a bit about support systems, I have included the First Link program, of course, because I am the First Link coordinator, so I can't not. So the First Link program is whether you're living with Alzheimer's disease or another form of dementia, or you're supporting someone who is, First Link connects you to our health services, information in your community from the time of diagnosis, hopefully, and then through the whole progression of the disease. But it doesn't have to be at the time of diagnosis. It can be at any stage in the disease when you'd like to avail of these services. And First Link is about helping you and your family make informed choices so you can live better with dementia at every stage of the disease. And we really tie in with the community programs and services as well. We try to keep strong partnerships in the community, so we have a vast knowledge on what's out there in each region for you to access as a caregiver. And like we're going through here today, of course, we're not the Canada Revenue Agency or anything like that, but like we do know what's out there, and we can give you their phone number and their website and things like that. But that's what we're here for, is to provide those numbers, provide those websites. We may not have all the information on it or be able to answer every question, but we'll for sure point you in the right direction so we know that those questions do get answered. And I, of course, listed the website, but my picture's cutting it off a little bit, but it's on your sheets there. So services you may be able to access in your community. Adult day programs are a really popular thing here in our region. As you all know, St. Luke's does that really popular Dementia Day program, which Kim O'Brien and Kathy Joyce do a great job of facilitating. That's a social worker and a nurse that facilitate this program at St. Luke's. And there's other day programs out there, maybe not dementia specific like St. Luke's is, but I was talking with a woman this morning about how her mother her mother used to play cards and be out around in that social setting. So we were trying to think about other things that are happening in the community that she could get involved with, because her card playing ability wasn't quite like it used to be. So we were like brainstorming a few things. I was like, oh my God, Zumba, Aqua Zumba. It's even things like that. Things that are fun and a bit of exercise. She likes the water, so this lady could get out and socialize. And sure, I go to Zumba, and I don't care if I'm doing the right thing there. So I don't really think it matters if you're following along properly. It just matters that you're there, you're a bit active, you're having a bit of a social setting and enjoying your time and having a bit of fun out of it. So you don't always have to think, oh, let's find a dementia-specific day program, or let's find a dementia-specific community service. It doesn't always have to be about finding something that is designed for a dementia individual. It's about letting this individual perform that at the level which they're at. It may not be as artistic as the next person, or as perfectly poised dance move in the water as the next, but all that matters is that they're enjoying their time. Excuse me. Losing my voice. So to speak a little bit about the Meals on Wheels program. Meals on Wheels is a great service which is at lots of different health regions, and each different case manager will be able to tell you which communities it is in which regions and things, but it is at a lot of different areas in the province, and it's a great program to avail of, to have a meal made so you get a bit of relief from making supper every day. So maybe you pick Tuesdays and Thursdays, I'll get supper made by Meals on Wheels, and then that's a little break for me from making the meals that day, and I get those little hour or two to enjoy my time. So some more community services would be our Seniors Resource Center, the City of St. John's, the Mount Pearl Seniors Independence Group. There's lots of different groups around in place, especially here in the Avalon, but then again, I'm sure that there are more throughout our province. And of course, some of these community service groups do service the whole province. Sorry.
No worries.
The Smart Fitness program is a really great one to get a bit of active living and healthy living going there as well. I was joking about the Zumba course and like added that one in there, but all of these things, staying active and getting a bit of exercise in your daily or weekly routine is a really positive thing. There has been lots of research recently done around exercise and especially dance and things like that, as it reducing the risk of dementia forming later in life, but it also the stimulation of exercise for an individual who's already diagnosed can be very helpful throughout their day. To be able to have that social setting, like I said, and then to be able to be up and moving around and keeping them a little bit distracted and stuff. So home care services and long-term care services are also always available in the community, and you can always find out more information about this through your case manager, social worker, or nurse. Even if you want to speak with your family doctor and things, any of those healthcare providers will be able to help you with guiding you in your health authority on how to access those type of services. Whew. I'm out of breath here today. Sorry, guys. I don't feel like, am I talking fast? Is that what it is? No? So I really like to bring in spiritual and emotional care as well. I always ask individuals if their mother or father who's been diagnosed had any involvement in the church previously, because staying intact with the church and things like that is always a great way to have spiritual and emotional support there. The churches can have lots of different programs on the go, community events and things like that, which are always fun to get involved with. whether it be volunteering or just attending one of their events. But it's also nice to have individuals from your church as a support system for someone to speak with if you ever were in need or anything like that. Support groups, we provide a family support group here the third Thursday of every month at 7 p.m. And that's here at our office. But we also have many other individuals throughout the province who, would hold these support groups for us. So someone out in Corner Brook and different things like this. Individuals who have journeyed with the disease and want to start a support group for others so they're able to learn and share together. Chat rooms and friendships are always a great emotional support there, and it's good to keep those connections with friends so you're able to get out and relax as a caregiver with a friend, or as an individual who's been diagnosed with the disease, don't stop inviting your friend over for tea just because you have this diagnosis. It's to talk about the diagnosis with your friend and just let them know where you are now in your life and what you may be experiencing as your symptoms progress and things. And there's nothing stopping you from continuing that friendship and continuing that relationship. Community groups, which you have been involved in, are always nice to try and stay involved with those as long as possible. We always say that to meet the person at the reality that they're at now. So an individual may not be able to read a book themselves anymore, but they can attend a book club if, say, there's a reading happening, or maybe it could be something that you do with your loved one. You read this book to them, and then you both attend the book club together. There's many different ways to adapt on how you used to be involved, so you can continue your involvement in these things. So to speak a little bit about the personal care again, our home care products and household gadgets, under the yellow pages, they listed as home care products, elderly, and disabled. So for a list of agencies and businesses in your area, you can flick to that tab. And for those of us who don't know what a phone book is anymore, there's always the website. I was actually at the Confederation building at the Office of Aging and Seniors the other day, myself and Liz were, and one of the gentlemen we were meeting with was like, phone books, here's a big pile of phone books, we're not sure what we're going to do with those since everyone has a Canada 411 app on their phone, but in case there's still one kicking around your house, it does have some good information in there. And these personal care products as well, we have lots of different brochures out here on Phillips Lifeline, which is a great program that's in place here in our province. And it's, I'm not sure if you've heard of the auto alert button before, for if a seniorly individual is to experience a fall or anything like that, then they would have this emergency button around their neck which they can press and connect them to an ambulance or whatever type of service it may be like that. So they have lots of different gadgets like that, and they're going to have more coming, like GPS trackers and things like that. So it's always cool to check these out. It's just different tools and tips and tricks and things like that to tuck up your sleeve, or just something to try to switch it up a little bit, right? So there are lots of brochures out there on the Phillips Lifeline programs. But this ALZ store is also a really cool one. The GPS tracking sneakers and there's all sorts of stuff like that, right? So if you got your loved one, maybe they have a wandering tendency, but they really enjoy their walks. So you purchase GPS tracking sneakers for them, so then you're able to know where they're going on their walk, and if they venture off of their walk pattern, then you're able to go and hopefully bring them back to their walk routine so they don't become lost or anything like that. So technology is really doing wonders, and some of the things are a bit pricey because they are new and innovative and things like that, but it's always good to look into it because you never know what you could catch on sale too. So to speak a little bit about what we do here, excuse me one more time. We have our resource library out there in the main room, which you all came into. The resource library, as I told a lot of you before, has a lot of great materials there. Has fictional novels, so you're able to just easy read and kind of get a fictional perspective on how this disease would affect an individual. I always like Alice. Alice, Still Alice? Yeah, Still Alice is a really great one for that. And we also have lots of different information DVDs and, of course, information books and research books and things like that. So there's a large amount of resources out there. And we have a list of all the resources, too. If you don't want to take the time to browse, but just flick through the list and pick what you would like to sign out. Since we're going with all the technology today, we have our website there listed as well. And, of course, our toll-free number, which you can give us a call at any time that you're in need. And I like to mention that you can participate in our support group. The family support group that I mentioned is the third Thursday of every month. Or you can set up a one-on-one support meeting with our Executive Director, Shirley Lucas, who spoke here at the beginning. Shirley has been with the Society for over 20 years, and she really knows her stuff. So if you wanted to sit down with someone and kind of talk about where you are and maybe get a few questions answered and things like that, Shirley is definitely the lady to be talking to.